This is a summary table of therapeutic notes about antipsychotic agents divided as first generation and second generation. Main drugs: chlorpromazine, moderate to high potential for EPS, extrapyramidal syndrome, moderate to high potential for weight gain, orthostasis, sedation, and antimuscarinic effects. Flufenazine oral formulation has high potential for EPS and low potential for weight gain, sedation, and orthostasis. Low to moderate potential for antimuscarinic effects. Common use is in the LI formulation, administered every 2 to 3 weeks in the patient with schizophrenia and a history of non-compliance. Haloperidol has high potential for EPS, low potential for anti-adrenergic effects or antimuscarinic, and also administered every 4 weeks. Now, second generation antipsychotic agents: aripiprazole, low potential for EPS, low potential for weight gain, low potential for sedation, antimuscarinic, approved for bipolar disorder, autistic disorder in children, adjunct therapy for major depression. Asinapine, low for EPS, low for weight gain, low potential for sedation, orthostasis. It is approved for bipolar and available in sublingual. Brexpiprazole, it has also low potential for EPS, low potential for weight gain and sedation, same, and used for partial response or refractory major depression and as with antidepressant. Cariprazine, same, and it is used for episodes associated with bipolar disorder. Clozapine, very low potential for EPS, but risk of dyskaryosis, for example agranulocytosis, risk of seizure, risk of myocarditis, cyalorrhea, weight gain, antimuscarinic effects, all high potential. Clozapine. Lurasidone, low potential and approved for depression, bipolar disorder. Olanzapine, low potential, same, but it is approved for bipolar disorder. Paliperidone, low to moderate potential, the rest is same, and it is approved for schizoaffective disorder. Quetiapine, low potential and approved for bipolar disorder, adjunct treatment for major depression. Risperidone is approved for bipolar disorder, autistic disorder. Ziprasidone, same, low potential for EPS, and it is contraindicated with patients of cardiac arrhythmias, minimal weight gain, and used for bipolar depression. Now, some of them are this: long acting, administered every 12 weeks. Paliperidone is long acting, and risperidone is long acting, 2 weeks. And with this, flufenazine is long acting for 2 to 3 weeks.